ask that you enter in any questions into the chat box. So with that, let's pull up our agenda. This is Megan Priolo with CRISP. We also have on the line from CRISP, Kevin Phillip and Sheena Patel, and also Audrey Speeder from H-Metrics. So welcome to today's session. Today we are going to provide an overview of CRISP, review some of the services that we have to offer in support of MDPCP, review a roadmap for CRISP, and then go through how to get access to MDPCP reports. And then finally, Audrey will walk us through the reports themselves, and we'll wrap up with some time for questions and answers. With that, I will turn this over to Sheena, who will go ahead and walk through the CRISP services.
Great. Thanks, Megan. I think we can go to the next slide. So I thought today I'll give a quick overview of services. Please, as Megan mentioned, feel free to ask any questions in the chat box, and we'll try to get to all of them at the end. So quick background about CRISP. We are the state designated health information exchange for the state of Maryland. We also are the HIE for the District of Columbia, and we provide the technical infrastructure for the West Virginia HIE. So you will notice if you are kind of on those bordering areas, you'll see data for your patients who might be going across the border. And just kind of a quick reminder that CRISP is really here to work with our stakeholders to make sure that you all have the right data in the right place, kind of at the right time as patients flow through the healthcare continuum. The next slide. So quick reminder that Maryland and DC, we're opt-out states, and that means that patient data is automatically opted in to be shared unless the patient contacts CRISP to let us know that they do not want their data to be shared. The way that we inform our patients about about their data being shared is through the Notice of Privacy Practices update that you would have had to complete as you onboard for CRISP participation. If you're not familiar with this, or if you want to kind of see what our suggested language looks like, please let us know and we're happy to provide it. A note that if a patient does opt out of CRISP, there will be no clinical information available through our portal, and they would not trigger any ENS notifications either. The one exception to this rule is the PDMP, or Prescription Drug Monitoring Program data. Because that's a state mandated program, patients cannot opt out of that. But everything else would kind of be taken out from our system. So quick overview of our services. We at CRISP tend to bucket our services into really 4 main categories. The first is point of care, and we'll kind of go through what each of these looks like. And so point of care really encompasses the bulk of clinical information, and that includes information available through our clinical query portal, as well as the prescription drug monitoring data. For those of you who might be hospital-based or have kind of single sign-on capability, some of you may also be seeing data kind of in context right within your EHRs. The second bucket of services is really care coordination focused, and that's our encounter notification service. And this is a roster-based service in which you, the organization, would send us a panel or a roster of patients you are interested in being notified about. And then when those patients move through the hospital setting, we will notify you in pretty close to real time. The third bucket of services is really kind of more the population health level. This is really our CRISP reporting services, where we use case mix data and Medicare claims data to provide reports where you can really do a lot of good work on the population health and aggregate level. The last kind of bucket of services is really public health, and this is really a partnership. This is through our partnerships with the Departments of Health in Maryland, DC, and West Virginia. And so through these partnerships, we're able to show our users public health related information. For example, Zika, overdose alerts. We have a C. diff alert. So there's lots of kind of interesting public health use cases that we're able to support. And then lastly, as you know, we're all here today for MDPCP, but we do act kind of as the program administrators for a lot of the care redesign programs, both hospital and ambulatory. So the unified landing page is really meant to be kind of your single access point into CRISP. We're very quickly adding all of our services into the unified landing page. And so our goal is to really have this be a one-stop shop where you have one username and password, and then you're able to access any CRISP service that you've been credentialed for. So currently we have PDMP, the clinical query portal, and our patient snapshot, which I'll show you. We are very quickly moving towards the other services being added, so keep an eye out for that. So the unified landing page is a pretty simple user interface. Essentially, when you log in, you get to a search screen where you can search by your patient. It is required to put in a last name, first name, and date of birth. We will then show you the most likely matches from our master patient index. You can choose that patient and then toggle from tab to tab there up at the top to see the service that you're looking for. Go to the next slide. So the first tab that most people use is the Prescription Drug Monitoring Program, or PDMP tab. And so if you're not familiar with the PDMP, this is a state-run program really created to combat the opioid crisis in the state of Maryland. The PDMP through CRISP contains Schedule 2 through 5 controlled dangerous substances prescriptions that have been dispensed in Maryland. That data is submitted by all pharmacies and then kind of served up through CRISP so that physicians can check the PDMP as part of the mandate. And so if you were to search for a patient and then choose the PDMP tab, you'd be able to see here kind of all the prescriptions that were dispensed for that patient. Any of the categories up top, or the columns rather, are filterable and sortable. And so if you wanted to look for a specific medication or perhaps medication that was prescribed by a specific person, you do have the ability to kind of narrow down on what you're looking for here. I would like to note that we also show interstate PDMP, and so we are able to show the Schedule 2 through 5 medications that were dispensed in any of the contiguous states to Maryland. Move on. So I mentioned overdose alerts earlier. We found that it's really helpful to know if your patients have experienced a recent overdose, and so we are able to show you, based on hospital data that we get in partnership with the state, if your patient has experienced a recent overdose, we can show you the event date, so when they actually ended up at the ED, where it happened, and then a description which includes the ICD-10 diagnosis code that was attributed to that event. This is really meant to just be more information as you make your clinical decisions. It might prompt a conversation or two, or kind of help that patient get the help that they need. Next slide. And then kind of moving on to clinical data. So there's two tabs in the unified landing page that contain clinical data. The first is the patient care snapshot tab. And this is really a high-level overview. This is not, tons and tons in bulk of data. But at a very high level, you can see there on the top right, you can see encounters from ADT, which is admission, discharge, and transfer. And so you can very quickly start to get a sense of, are your patients going to the emergency room every 3 days, or are they having long inpatient stays? You'd be able to kind of see that in a graphical and in a tabular view. If you look under that box there on the right, we have the care team. And this widget we found from the care coordination perspective is really, really helpful. And so I mentioned those rosters that folks submit to populate for the encounter notifications. When you submit a roster to us, we are assuming that you have a treatment relationship with that patient and therefore are part of the care team. And so we can take all of the organizations that are sending us a roster with that patient on it and start to build a care team here for you to see. And then the last little piece I'll mention here is care alerts, which is there on the left. And these are very quick snippets of information, kind of critical need-to-know information that we've just kind of pulled out from other records. And we found that it's really an easy way to see kind of the most important information about a patient without having to dig through tons and tons of clinical data. The next slide. So the last second tab that's available for clinical data on the unified landing page is our clinical query portal. Just FYI, it is probably within the next few weeks switching over, so it will no longer be called the query portal, it will be called health records. We've just kind of moved our user interface over to a different platform. It's much more dynamic, much more flexible, but you will be able to see the same information. So your labs, your radiology results, your transcriptions, and your images will be available. You can see here on the right, I just blocked out the patient data. But if you go to the next slide, Megan, this is kind of what it'll look like. So you'll be able to see all of your same lab results. You'll be able to search by provider or result or date, and then you can view any of those observations and have the option to print or download as you please. Next slide. So the second bucket of services that I mentioned was the encounter notification service, and it's a pretty simple workflow, but it's been really, really effective to coordinate care. And essentially the way it works is the patient goes to the hospital. When they are registered at the hospital, we essentially get a copy of that registration message, and then we're able to shoot out a notification to any organization who has signed up and sent a patient panel and wants to be notified about that event. Next slide. And so the way that most people have chosen to receive these notifications is through what we call ENS prompt. And right now, I mentioned earlier, this is a separate username and password, but very shortly it will also live in the unified landing page. And the way that it works is you would see on the left-hand side, you kind of have a rolling list of all of your notifications with the more recent ones populating up top. If you were to click on any card there for any specific patient, the right-hand side will populate with information about that encounter. And so you can see things like the date stamp, what type of event it was and where. If we have a chief complaint or a discharge diagnosis from that hospital, we will share that here as well. Another neat feature here is that you're able to actually see the last few events for that same patient, which can really start to give you a good idea of who are your frequent flyers that maybe you didn't know about. Are people maybe going to different hospitals for the same chief complaint? You know, are there things that maybe you could impact throughout your work? And then the last thing I'll say is you're also able to, in ENS prompt, see very quickly the number of inpatient and ED visits for that particular patient in the last 6 months. So it's a really easy way to kind of get an idea of how much your patients are utilizing the system. Next slide. So this is another new feature here, the census view. This is a new view of the same data that we are working on rolling out in the near future. And essentially it'll show you who's currently hospitalized on your roster, who's currently in the emergency room, and who's been recently discharged. And we found, just getting feedback from folks that this type of kind of tracker view is much easier as you've got care managers and other folks really trying to locate patients and follow up for specific circumstances. So you can imagine that you might have somebody working recent discharges to get them back in the office for a follow-up, whereas you might be contacting discharge planners for currently hospitalized patients to start to coordinate care and prepare for discharge. So we're really excited about this new tool here. And so those are really kind of our core services. If you are not using some of these services and would like to, please let us know. We're happy to get you started. I will mention, in terms of this MDPCP program, I know it's kind of unique with some folks utilizing CTOs and others not. There are a couple of different options of how you can submit your rosters as a CTO or as a practice. And so if you really want to optimize how this works as you're partnering with your CTO, please let us know, and we're happy to kind of walk through the different ways that we can make sure that you're getting the right information.
Great.
And that's it for me.
Great. Thank you so much, Sheena. So now we're going to move into the reports for MDPCP, starting with credentialing and how to get access to those reports. Before we jump into that, I want to take a moment to remind folks that the lines are muted, so if you do have questions, please feel free to enter them into the chat box. With that, I will turn it over to Kevin.
Great. Thank you, Megan. So I'll talk about credentialing and how users get access, and then how, if you are a point of contact, how you add new users. So in order for an individual to get access to the MDPCP reports, we require a photo ID. This could be a work badge or a driver's license, and a signed end user agreement. And we also require a CRS POC approval for that user. If you don't know who your POC is at your practice, please email us at support, and we will let you know who that individual is and direct you in the right direction. So if you are a point of contact for a practice, you will see this additional card on your dashboard when you log into the CRS portal, and that is CRISP Credentialing, or our Log Once application. So once you click into that card, you'll see your screen where your organizations that you are a point of contact for will be listed on the left side, and you'll be able to see all the users who have access to the reports. If you're going to add a new user, you would click the Add User button on the top left, and then enter all of the information here, and then click Save. Once you do that, you'll be able to add report roles to that specific user. So you can see here on the next page, this window will pop up, and you can click MDPCP role for that user. Once you do that and click Save, our support staff will receive a ticket to reach out to that user individually to receive the documentation I talked about at the beginning, the photo ID and the end user agreement. And once they receive that information, they'll go ahead and activate this account, and they will receive an email with an activation link to go ahead and log in. So this is the workflow that I mentioned. So if you are a point of contact and you add a user, you don't see them activated right away, that's okay. Our support staff will step in and collect the documentation needed to maintain our records and get users the access they need.
Great. Thank you, Kevin. So once you've gotten access to the reports, next question is how do you use them? So with that, I'll turn it over to Audrey Speeder, who will give us an introduction and demo of the reports.
Great. Thank you, Megan. Good afternoon, everybody. Thank you for joining us today. I look forward to reviewing with you all of the PDMP reports. MDPCP reports. They've all been in production for a few weeks now, so we hope you've had an opportunity to go in and view some of your reports and start to poke around a little bit. So I'll be giving you kind of a high-level summary after this brief introduction, and then we can open it up for any questions. So just to start, the MDPCP reports are powered by the Medicare claim and claim line feed data. This is the CCLF data that you would also find in our MAID reporting suite if you use that. This is monthly data received from CMS that represents the last 36 months of all claims for Medicare beneficiaries. So we receive this file every month from CMS, and based on the attribution files received from CMS, we're able to kind of generate this reporting suite for only the MDPCP attributed beneficiaries. So again, this is only your fee-for-service beneficiaries that are attributed to you under this program. Each month, generally the second Friday of every month, the reporting suite will be updated with one new month of information or one new month of data. So our current environment has data through November 2018. You can expect in about, I guess it's a week or two, March 8th, we'll get data through December 2018 available in the reporting suite. As for the attribution, we receive that information annually from CMS, and there will be kind of incremental modified files received quarterly as beneficiaries are eligible or become non-eligible for the program according to MDPCP rules. And last, one word on credentialing. The credentialing is only available for PHI users. Everything in the reporting suite is considered PHI. We have a lot of patient identifiable information, so that's just something to be mindful of as you credential users within your practice or within the CTO. All right, so to get started, to access the MDPCP reports, you'll be able to get to the card through any browser. Safari is also supported here as well, just not listed above. And once you go through the CRS reports portal, you'll see a blue card like you do on the right saying MDPCP reports. Clicking that will get you right into the reporting suite. So just a quick word on the goals of the report. The reports were really developed to support the program and all of its initiatives. So first and foremost, we wanted to make sure that users were able to monitor population level trends on key utilization and payment metrics. So we looked into several of the metrics that we thought would be most important for the program, focusing on inpatient use, ER use, total spend, and wanted to make sure to design reports that would support that. So we're looking at population level trends for your attributed population with the customization needed in order for you to really customize those views and get out of it what you need. The second goal is to provide insight into where providers may focus their care management. So this is looking to understand if there's specific disease categories, specific risk tiers, specific demographic populations. That may be your low-hanging fruit, where intervention or care management might be most fruitful or might provide the largest impact on overall utilization for the beneficiaries. And last, we have patient-level information as well as population-level information to improve care coordination. So if you're interested in understanding what specialists are touching your population, what other providers, what types of services they're getting, we wanted to make sure that those reports provide that level of detail for you. So some general features of the MDPCP reports. You can view information for one or more CTO or practice at a time. So what was really important in the development of this is that we want to make sure to cater to practices that are looking only within their practice, as well as CTOs who are looking across multiple practices. So through a series of drop-downs, which I'll show you in a few minutes, you can select all CTOs or practices for which you are credentialed, or look at individual practices specifically to drill down into that population. The rest of the reports are also customizable for risk tier, for state comparisons, and for date filters. So you can narrow everything down to, if you only want 1 month of information, a quarter, 6 months, a year, you can go back as far as 36 months and look at patient utilization. There's also a user guide available in the help desk, which I'll draw your attention to when we get there, that has screenshots of all the reports and how the reports can be interpreted. And all the information in all these reports can be either printed to PDF or downloaded to Excel. So you can pull that data down and use it with the other resources that you have available within your organization. And last but not least, we have patient and claim level details that I'll point out. So on this last slide, before we get into a real demo, is just a quick highlight of the reports overall. We have 7 reports available. We start with kind of a summary dashboard that kind of gives you a good lay of the land, and then 6 additional reports that provide detail, each on a separate topic. As I mentioned, we're focusing on key metrics, focusing on demographic characteristics, per member per month spending, count of inpatient admissions or ER visits per member per month, per 1,000 beneficiaries. So it's in total or per 1,000 beneficiaries, as well as readmission rates. And then provide drill-throughs throughout the reporting suite. So at any given point, if you customize a report and get information you want, you should generally be able to get a list of beneficiaries that meet the criteria with your query. So let's jump over. Give me 1 second to set my screen up. Megan, can you confirm you can see that?
I can.
Awesome. Okay, so once you get into your CRS portal, like I said, you're going to see your MDPCP reports card. And by selecting on that card, you're going to get right into our right into the portal. The first report you're going to see is your population summary, but I want to give you kind of a quick lay of the land of how everything is laid out here. On your left side menu, you're going to see each of the reports identified individually. You can feel free to navigate to those as you'd like. There is a master filter on the top where you would be able to identify the CTO of interest and the practice name. If you are a CTO, you would likely only have one option here, but have multiple practices under practice name, unless you are credentialed if you're somehow involved in multiple CTOs. If you are from the practice, you likely only have your practice identified here unless there are others that you are able and credentialed to be seen. Once you apply this filter, it'll apply through all of the reports uniformly. It's not something that you need to keep adjusting as you navigate through the different reports. Our next set of drop-downs, at least for population summary, is going to focus on tiers and dates of service. So one drop-down that we thought would be very helpful is to be able to just drill down into any of the risk tiers at any point. So we have here that you can look at any specific tier. I'm just going to select on tier 2 for this quick demo, and automatically this population summary will update to tier 2. And that information will be updated in just a second. While that's working through, you also have the option of changing all of the dates, which I identified earlier. So right now, the default is going to be through September 2018 is for our demo. You have information available through November. And then December will be available the beginning of March. That got hung up a second. We'll give that just a second to refresh as I keep working through this. So while you're once you go through your tiers and once you go through your dates and customize this to as you like, this first population summary is, like I said, identified as a high-level dashboard. So we have our beneficiary count, and our claim count shown as the first 2 bubbles, with our average risk tier as well, so you can just see across the entire population how it's looking on risk tier. And then we have key metrics on the right side. These key metrics are conditionally formatted, so you can easily see how you compare to the overall state in the program with color conditional formatting to understand your direction. So anything in red here is going to be an indication that you are worse off than the overall average, not necessarily a level lower. So for example, for ER visits, it'll be high ER relative to the overall, and the color indicates the intensity of that difference. There you go, that took a second. So as I saw in tier 2, all of this populated and updated differently. So I can see quickly that for member per month and readmission rate, my rates are lower than the overall average beneficiaries in the program, whereas red, I have higher admissions and higher admissions per 1,000 and higher ER visits. By clicking on any of these links, I'm able to directly link to the various reports that'll give me more information about this variable. While I'm here for beneficiary count, if I just wanted to receive a list of all of the beneficiaries that fit this criteria, if you click on the bubble, you'll see the beneficiary details, and I have a list that I can now export to Excel or print to PDF. I should say before I go any further, all of this is demo data. This is all de-identified, masked data just for the purpose of the demonstration. So there's no PHI on your screen right now. And a nice enhancement that we were able to add just in our last update is that we were able to add county name and zip code. So in addition to general demographics of MBI, name, gender, age, HCC, We've now added county and zip to help you link the beneficiary in this report to other internal resources you have in your organization. The same level of detail is available for the claim count. I'm not going to access that right now because that does take a while to load. But what the claim detail provides is for every patient, it is every claim that they have over the time period of interest. So right now I'm looking at a 36-month period. It would give me all claims for all beneficiaries. That's really helpful as a working file if you want to pull that in, use that with other resources within your organization. Okay, the one last thing I didn't talk about when we talked about date is that there is a built-in lag in these reports. So if I were to select any date after, October, if I were to select October or November of 2018, I would see a notification here that my report includes claim lag. What's really important just to remember there is if you're looking at trends over time, or if you're looking at utilization, per 1,000 beneficiary, we just want you to be aware that the claim processing may not be complete for those months, and you will have to be really careful with your interpretation of your results. If you do not see a big red disclaimer here, you're in the clear. For September 2018, all claims are considered complete. Oops. I actually didn't finish out that report. At the bottom of the report, you saw the distribution of age, and you also saw the distribution of total spending by claim type. So you'd be able to quickly, easily see in that donut chart what is the total distribution of spending by each of the various claim types, as well as the age distribution. All right, so as we wait for this one to load, we're looking at the base versus the current year comparison. This is the first real analytic report in this suite. And the idea here is to provide a benchmark so that you can understand how your performance is comparing to the prior year. So we have a base year programmed of January 2017 to August 2017, with current year January to August. All of this is based on the time period being the year to date in this dropdown. If I were interested in looking at the last 12 months, I would be able to select that, and everything would populate to be the 12 months prior for 2017 versus 2018. And then in this report, you can easily see, based on blue being base year and orange being the current year, that your how performance has changed, and performance being defined as per member per month by claim type. So I can see pretty easily that my current year per member per month spending for short-term acute care hospitals is much higher than my base year spending, with a 35% difference when looking over the same period. So this is a good quick view of what's driving some of your overall differences between your current year and your base year. So moving along, as we look into our demographics, this is a report that has several charts embedded into it, so you can really understand your population based on key demographic factors. Excuse me. We bring in risk tier. We bring in also your more standard demographics as it relates to age, gender, dual eligibility, and others like that. There's also a comparison that I'll point out. There you go. There's also a comparison to the state, which we'll go over in just a second. Actually, no, let's cover that now. So we have the same drop downs on the top of this report. You have tier and you have your month start and month end date, but we have a statewide comparison that could be helpful for you, and there's two options within that. So the default is going to be the state for MDPCP. This is going to be a statewide average for every attributed beneficiary that is enrolled in the program. So anybody who's in the program is going to be included in your comparison. As an alternative, you can do the Maryland state overall, which will include participating and non-participating practices or beneficiaries. It's statewide overall, regardless of program participation. So all of those comparisons are going to be shown as the red bars across these reports. And you're able to see, just kind of at a quick view, how your distribution differs from the overall state comparison that you select. In this first column here, we focus on risk tier. We're looking at the distribution of beneficiaries by risk tier with the statewide comparison. If I were to select the state as my comparison, these red bars would not be available, which kind of makes sense. If we're looking at people that are not involved in the program, we won't have a state comparison for them. So we have the distribution of risk tier, and then closely related to that, we have the average HCC score for beneficiaries within that risk tier. If I wanted to understand more about a certain risk tier, if I click on the x-axis here, I'll be able to access the beneficiary details. And a report very similar to what we've previously seen will pop up with each of the individual beneficiaries identified, a few key demographics for them, and the ability to export or print. So this functionality to drill down is available for all of these reports, so you can identify who is captured in each of these segments. We have distribution by age group and race, as well as dual eligibility and gender. So the next report takes us to per member per month trending. So this is a helpful one that looks at each of the various care settings separately, breaks down the per member per month spending, and provides some detail on what's driving some of that spending. So as soon as this loads, I'm going to show you, I'll show you the overall report design, and then there's some special or more intricate drill downs available for physician spending, understanding that one of the large interests of participants in this program is understanding physician services, specialty services, where and how those services are being provided. We'll give this just a second to load, and then we'll walk through that. Okay, while that's working its way through, I'll give a quick introduction to the next one. Sometimes this one gets hung up on a demo site. So once we go through the per member per month trending and understanding all of the utilization patterns, or all of the kind of the drivers of utilization within each of the segments, we'll look into payment bands, where we'll be able to look at kind of more high utilizing beneficiaries and see where the cluster of spending is across our beneficiaries. Okay, here you go. So for per member per month trend, we have the same drop downs as the remainder of our reports, and you'll see the first charts are looking at PM spending by claim type. So you're able to see your statewide comparison. Again, you can customize what that statewide comparison is. And you're able to look at the aggregate of Part A versus Part B spending. And for a trend analysis, we have each of those care settings shown separately for both the practice and the state. And then towards the bottom, we have the top providers for the segment that you have selected. Since I have not selected any claim type above, this is showing me my top providers by payment amount overall. So you're going to be focusing more on your hospitals or your inpatient settings on top, just given their high overall cost relative to physician services. All of this is sortable. You'll see that little sort icon right there. All of these are sortable, so you can customize this view across any of those three columns. So one thing I want to show you here is if we were to select on outpatient, if I wanted to only look at my outpatient hospital, this report will update and it'll isolate the outpatient line in our line chart. It'll also focus only on the outpatient providers on the bottom. And we'll see just only outpatient down there. There you go. So we see only our outpatient line by quarter for the last few years relative to the state, and only our outpatient hospital providers here. If I were to look at physician services, I get a bit more information. we actually break it down to look at the specialty of the physician and another variable. So let's give that a second to update, and we'll. Here we go. So by selecting on physician, my line chart has updated to physician, but now I'm able to get more information about the provider specialty and the individual providers for those claims. So I can now understand, again, all of this is sortable, what's driving my physician per member per month, and who the individual providers are. I went ahead and selected on vascular surgery if I wanted to drill down more into my vascular surgeons. By selecting that, my right side of the report updated to show me only those vascular surgeons that were providing services. So this is kind of a helpful way that you can drill down into understanding your utilization trends to see if there are, to see if your dollars are concentrated within specific specialties or specific physicians. And again, this can all be exported out. So payment band. So payment band is our next report. As I introduced very briefly earlier, that you can start to identify the different kind of where your population, how your population is distributed by payment band. Are there a lot of beneficiaries that are very high cost, or where's the frequency of those beneficiaries? So this will be a bubble chart we'll look at in just a second, and you can drill down to understand the beneficiary population that has over $75,000 in spending, for example. And this is where you can have discussions with the practice or with your CTO to understand where you want to target beneficiaries, and you can understand their overall utilization. Apologies for the delay. It's running slower than usual today. Okay, here you go. So we have here your total payments by payment band. Like I said, I can easily identify my the beneficiaries with my y-axis being beneficiary count, x-axis being the payment band for their utilization. I can see that I have just a few beneficiaries that have more than $75,000 in healthcare spending. They represent, I think it's $1.5 million of my total. So I would be able to drill into this and get more information. Oops, you should be a hover over there. You can get more information on who is in those which beneficiaries are in that tier. Likewise, this right side is showing a slightly different view, which is just the distribution of spending, or distribution of beneficiaries by payment band. So I can see that I have 30% of my beneficiaries falling within this $1,000 to $10,000 range. This might be helpful in your decision making and how you target beneficiaries for intervention or management. And the bottom of the report is just showing the same information but in tabular form for those that just want to be able to look at it that way. And we have the practice as compared to the state as shown by, it's a practice compared to the state. We are working on the enhancement to bring in the 2 state options. That's an enhancement that's going to be added into the reports, you know, in the next update or 2.
Audrey, this is Zach, 1 minute.
Mm-hmm.
If you want to do a drill through from here, you can just select that beneficiary count on the table.
Oh, from here.
Yeah.
Perfect. Thank you, Zach. I knew that I was missing something there. So the beneficiary count is accessible. The drill through is accessible through the bottom table. Great. So let's move on now to diagnoses by CCS categories. I'll try to wrap these few up in the next few minutes, so we make sure to reserve time for questions. The diagnosis by CCS category is another way to array the beneficiaries based on primary diagnosis. So we're looking at CCS categories, so clustering of diagnoses in more meaningful buckets, where you can see what diagnoses are present within your population. So here, the circle size is going to indicate the dollars. The color is going to indicate the number of beneficiaries. So you can pretty easily see that I have a lot of beneficiaries with diseases of circulatory system. They represent a large amount of total spending as well. And you're able to drill down and understand who those beneficiaries are and get their beneficiary details. The right side just shows the distribution of beneficiaries across all the categories. As you well know, these are not mutually exclusive categories, so beneficiaries are represented in multiple rows here, multiple bars. And with a statewide comparison, so you can understand how your population may differ from the state. And same with the tabular view on the bottom. So inpatient and ER utilization, this is a great report that you saw a lot of those metrics on the population summary on that first dashboard. So if you were to select those bubbles on that first dashboard, it would link you directly into here to understand about IP or inpatient and ER utilization in total or per 1,000 beneficiaries. We also have a metric here for readmission rates. So we have basically three parallel columns focusing on inpatient, readmission, and ER. You can understand you can get drill throughs here to understand who in the practice has had these services. So the inpatient admissions, which beneficiaries have had inpatient admissions. You see the trend lines here overall for the practice relative to the state. You'll have a lot more consistency on the state trend just due to just the universe of looking across the state. And the bottom is showing us the beneficiary counts by admission. So this would be helpful for me if I wanted to understand, okay, I have 2 beneficiaries that have had 7 admissions in my time period of interest. I want to understand who these 7 are. You can drill down and get a count of you can get a list of those beneficiaries that have had those 7 admissions. So it's a good way to target intervention in that respect. And have the same information presented for both readmissions and for ER. The last report is professional services. So this is another opportunity to drill into the physician services and not only understand who's providing it, but what services are being provided. So this uses a Beto's construct, the Berenson-Eggers type of service taxonomy that has been used by CMS for quite a long time to cluster procedure codes into categories that are slightly more meaningful. So this is an interactive report that allows you to filter very easily to understand more about utilization patterns. So on the top, I have each of my Beto's categories. I can understand pretty quickly how many beneficiaries have had each of these services and what their claim payments are. And then going across the bottom, we have the specialties, places of service, and providers for those services. So if I were interested in understanding only my procedures, I wanted to target only the beneficiaries that received a procedure. You might have seen that all of this updated to only focus on the procedures. So I now see the top specialties for those, places of service, and providers. I can continue to drill through. If I only wanted to look at my procedures for vascular surgery, my places of service update, as well as providers. And if I wanted those vascular surgery procedures provided in the office, I have identified my providers that are the providers who have actually, the surgeons that have actually provided that service. I've clicked through it in a linear way, but you can use any combination of these filters in any order to subset the population of interest. Okay, so that takes us through all the reports. The last thing I wanted to just point out is this help desk here. If you were to select on this help menu, you would have a link to the user guide. We strongly recommend you take a look at it. It provides screenshots of all the various reports, defines all the measures that are included in them, and a brief introduction on how the reports can be used and how they should be interpreted. So it's a long document, but I hope it's helpful as you're working your way through these reports. And with that said, Megan, I'm going to turn it back over to you and Kevin, and we can see if we have any questions.
That sounds great. Thank you, Audrey. So Kevin, have we received any messages through the chat?
Yeah, so our first question is about the population summary report. Audrey, could you explain what the per K means in some of these metrics and how that formula is calculated?
Sure. So we're showing in many times a utilization per thousand metric. And the goal there is to be able to trend information over time and to be able to look at it across the comparison of the state. So the calculation for that is really the number of services. If we're looking at inpatient admissions per thousand, number of inpatient admissions per 1,000 attributed beneficiaries. So this way, if I look across my my IP per thousand beneficiaries for my practice, I can compare it to the state and know that we're not talking apples and oranges. If we were to present only the raw numbers, you would see we have both here. We have 94 as a raw count. We have 303 per thousand as a rated measure. If we were to look at only the raw count, the sample size would be skewing the interpretation significantly. So this would allow me to say I have 303 inpatient admissions per thousand in my practice. And when I look at a specific tier category, or if I look across the hospital, the state, that 303 is rated to the other population, so I can understand really which one is higher and lower. Go ahead, Kevin. I'll pull up a better example of that in a minute, but
Thanks.
go right ahead.
So the next couple of questions are about risk tiers. So first, some background. Can you explain what some of the differences between the risk tiers are and how they're determined?
Sure. So the risk tiers are actually determined by CMS. We were not involved in the development of the risk tiers. That was provided to us with our attribution files. But it is my understanding that the risk tiers are based on the HCC score for the community HCC score for the population. So looking at historical claims information, I think it's back 2 years or so, CMS has determined the HCC score for each of the each of the beneficiaries, and then they're put into tiers based on the percentile that they fall into. So there are a few caveats to that. If you have instances of substance abuse or mental disorders, you automatically get put into this this complex tier. And it's my understanding that new beneficiaries that do not have the claim history to generate HCC scores automatically get defaulted into tier 2. So again, this is information that's provided to us by CMS. It does stay static for the year. A beneficiary can change risk tiers across years, but within a year, they stay in the risk tier that's assigned to them.
Thanks. Which report would you use to get a list of the high-risk patients in the high-risk tier and download that detail?
Sure. So if I just wanted a list of who was in my complex, I would do that from population summary. So from population summary, I think the most straightforward way is that I would pull a report only for my complex tier and then access the beneficiary details that way. If you're looking to define your high risk by another metric, so for example, if you're looking to define that as high healthcare spending, I would consider doing it from the payment band, and you can look at the beneficiaries that fall within the payment band of $75,000 or more, or any other measure that you find appropriate for your cause. But if you want to do it from a risk tier perspective, let's see if this loads nicely for us. By selecting complex up there, this beneficiary account will update from 121 to only be the complex tier, and you can download the list from there.
And Audrey, when we download that list, will it say the risk tier associated with all of those patients if we did it for all risk tiers?
That's a good question. It does not identify risk tier. it does identify the HCC score, which is certainly related to that. That might be a helpful enhancement that we look into adding into this report. So currently you'd only have the risk tier and you would have to do it by that way. But what I did just now is my complex risk tier only. So I know that all of these are in that tier.
And I'll end with one last question. Is there any information on dual eligibles in these reports, and are those patients included in the MDPCP program?
So dual eligibles are included in the MDPCP program. I think there is one exception, which is if they are in, I think there's a medical home model that's open only to dual eligibles, and if they're involved in that, they are excluded from the program. But dual eligibles, fee-for-service dual eligibles are included in MDPCP. In the demographics report, we do have one bar chart that isolates them out so you understand the proportion of the overall population that are dually eligible. And you should be able to get a, you can get the beneficiary details for that population. That filter is not available in the other reports though.
Thanks. I think for the sake of time, that'll be our last question, but if I didn't get to your question, I will follow up with you afterwards. So with that, I'll turn it over to Megan.
All right, great. Thank you, everybody. And Audrey, there you go, you read my mind. I will just share our contact information. So as you're working through the reports and working through getting access, whether it's ENS or the query portal or any CRISP service, feel free to reach out to CRISP support. And if you have questions about the program, we've got the MDH program model information listed as well here for you to reach out. And as a reminder, we did record today's session, so we'll be sure to send you the link so that you can refer to it later. We'll distribute the slides as well. As you continue to work through the reports, please feel free to reach out to us, and we're happy to help you leverage the data. So thank you very much for your time this afternoon, and have a wonderful day.